In addition to the cognitive deficits of dementia, the behavioral and psychological symptoms of dementia, or BPSD, are an integral part of dementia. BPSD is common and occurs in up to 90% of patients over the course of the disease. It is a significant cause of distress in people with dementia as well as their carers, and if untreated can lead to premature institutionalization. Definition: BPSD refers to the symptoms of disturbed perception, thought content, mood or behavior that frequently occur in patients with dementia. These symptoms include anxiety, depressive mood, hallucinations, misidentifications, delusions, apathy, negativism, disinhibition, sleeplessness, agitation, physically aggressive behaviors, restlessness, screaming, wandering. Assessment: a comprehensive diagnosis of dementia must include an assessment of cognitive and behavioral symptoms as well as the needs of the family. In the initial assessment, any medical causes for the behavioral symptoms must be sought and laboratory tests to exclude treatable causes are necessary. These causes can be delirium, constipation, pain, discomfort or sensory impairment. Management: the main objectives in the management of BPSD are to maximize functional independence, improve the quality of life of patients, minimize caregiver stress and distress, and help families cope with the behaviors. After comprehensive assessment and treatment of underlying medical causes, specific BPSD are identified. The general principles in management are: to understand the cause of the behavior disturbance, decide if the symptoms need to be treated, formulate a management plan with the caregiver, implement specific strategies, review care plans regularly. General advice for caregivers includes maintaining a calm, familiar environment with a regular routine, organizing an activity program that is appropriate to the person with dementia, or arrange for the person with dementia to attend a dementia daycare center. Caregivers need support and can seek help from family support groups and counseling centers. Non-pharmacological management. Non-pharmacological interventions are usually first-line management for mild to moderate BPSD, and it has been shown that environmental and behavioral interventions in conjunction with caregiver education, training and support are effective. Pharmacological management. Medication is indicated if non-pharmacological interventions have failed or when the symptoms are moderate or severe and has an adverse impact on the person with dementia or his caregiver. Guidelines to pharmacotherapy. Treat only moderate or severe BPSD with medication. Use lower doses, especially in the elderly. Target specific behaviors, for example hallucinations, delusions. Aggression. Start with one drug at a time. Be aware of adverse effects and drug sensitivity. Regular reviews of medication effects and side effects. Make sure use of medication is time-limited. In summary, behavioral and psychological symptoms of dementia are common in dementia. They cause significant distress to people with dementia and their carers. In managing BPSD, medical causes such as delirium must be excluded. Non-pharmacological management, such as environmental and behavioral interventions, are effective first-line strategies. Medication may be useful in moderate to severe BPSD but must be used carefully in view of the risk of side effects.
Audio Jungle. Audio Jungle.